If we're gonna mention polypodium, and I think we should at least mention niacinamide, right? And why don't you take it away about what this oral supplement does?
Yeah. This is another oral supplement. The study was very, very well done a few years ago, published in New England Journal of Medicine, which is obviously a very, very prestigious peer-reviewed medical journal. The study was done from Australia. Essentially, what the investigators did is that they gave a group of individuals. These are all, they collected, first of all, a cohort of high-risk individuals. These are individuals who are known to have higher risk of developing skin cancer. Some of them had history of skin cancer. So they divided the group into half. One half would be given niacinamide. The other half would not be given niacinamide. And they measure the development of actinic keratosis, which is the sunspot precancerous skin condition, and they measure the development of skin cancers in these individuals. What they found is that after a year, there was probably 6 months. After 6 months, there was a decrease in the development of skin cancers, in the development of actinic keratosis in those individuals who were given nicotinamide, compared to the control group. That's the strength of the study. One, they have large enough cohort of patients or subjects that they can compare the data from control group and for the group that had been receiving the nicotinamide. And what the other part that was very interesting is that after the completion of this studied phase, they stopped the study and they let the individuals who were taking nicotinamide not to take any nicotinamide anymore. So they go back to this, or like the rest of the control group. And what they found is that the rate of the precancerous skin condition, actinic keratosis, and the rate of skin cancer went back up to the original baseline state, indicating that for nicotinamide to work, one has to take that all the time. Which makes sense because nicotinamide is that what the proposed mechanism is that it prevents what we call the energy crisis within the cell, because when cell is exposed to sunlight, they went into energy crisis because of that they cannot repair the damage of the DNA as well as otherwise, and then nicotinamide would prevent that, and so the cell continued to have the energy to repair those damage.
No, that's yeah, I mean, I think those are the two of my favorite oral supplement that I recommend to my patients, right? And I know there's a lot of stuff out there, like a lot of antioxidant, vitamin C, E, and other antioxidants, but those two are perhaps most well studied. And I mean, I think just in the context of beating melanoma, and the nicotinamide data is basically coming from preventing actinic keratosis and preventing squamous cell cancer, but not melanoma. But you know, the idea, the extrapolation is both melanoma and squamous cell, basal cell, they are induced, caused by UV damage. So
correct.
Sometimes you just need a large, huge cohort, follow them over a long period of time, and just realistically speaking, those kind of studies just really difficult to conduct, basically.
Yeah. I think that is the reason that, you know, a Dale Green study, which is from Australia, also they were able to look at melanoma because they have large enough cohort, but also they have long enough follow-up. But even with that, the number of melanoma is very, very small. So, you know, in terms of statistical analysis, you cannot get the power to do that, but you can see the trend.
Yeah, you can see the trend. You can see the trend. And I think for the sunscreen one, and they actually did show 50% reduction in melanoma, but you know, but not the nicotinamide one. Well, Henry.